Really we're in the, the ascendancy of BRCA, really needing to know our patient's BRCA status, and we're kind of creeping up on a new subtype here. You think it might just be easier in the future that just everybody gets testing as soon as they're diagnosed, so we don't miss people? At least the HER2 negative, we don't have the HER2 positive, but it'd be a lot easier for me to try to just do it that way,
Well, you're preaching to the converted, I would have to say. I've always thought ER, PR, HER2, and BRCA in every breast cancer, but I think, what does the data say? I think if everybody were to use NCCN criteria, we'd find most of the germline BRCA mutation carriers. And if technology would help us do that, that would be great. But we're not there, and there's a lot of under-testing. And in fact, just this month, EPUB JCO has a paper in which they looked at patients, I think in Georgia and LA, they surveyed 5,000 breast cancer patients. They found 1,700 that fit NCCN criteria, and less than half of them had had germline BRCA testing. And if you ask them why, that half that didn't get it, half of them said, I never even had a conversation. Forget about a genetic counselor with my doctor. So I think there's so much under-testing that anything we can do to identify every single patient with a germline BRCA mutation would be good.
Right. Even if we use this as an opportunity to remember to revisit family history, right? Because we have the pleasure of taking care of women for many, many years, and to recognize family history changes and updates over time. So use this as an opportunity to just check in and see, are we missing the chance to test someone who really deserves testing meeting NCCN guidelines?
Absolutely.
And it may be as we get more data around PARP inhibitors and their efficacy across multiple germline mutations, it'll become more and more standard to just do the testing up front on everybody, because it won't just be BRCA, it won't be a larger subset. And also, of course, if we get the PARP inhibitors into the curative setting,
right,
and they show benefit there, then it's going to be even more compelling, to not miss those patients if it's going to have a positive outcome.